The overhyped skin tightening device everyone's talking about right now has exactly one published study behind it, and it was done on 2 to 3 month old pigs. Yet clinics across the country are already selling it. I'm Dr. Kate D, founder and medical director of Glow Medi Spa, and this is Med Spa Confidential, where we expose the risks, the red flags, and the outright illegal practices happening inside med spas right now, because you deserve to know the truth before you book. Today, I'm talking with Dr. Corrine Erickson, a board-certified dermatologist and owner of Georgia Skin Specialists in Atlanta. She's been evaluating RF skin tightening devices long enough to know which ones actually hold up. You'll find out why some older devices like Ultherapy and Thermage became known for pain and complications. And you'll learn what truly comfortable skin tightening actually feels like, why the cooling technology in some devices like Everest matters so much. And you'll hear why the immediate tightening you see after treatment may not be the long-term result patients think it is. Stay until the end because Dr. Erickson shares the one question you should ask before you ever book a skin tightening treatment. So thanks so much for talking to me today about this. I'm really excited.
Oh, me too. Thank you so much for having me.
When you and I first connected, we both felt very similarly about a few devices that were like, that's old and nobody wants to use those anymore. So I kind of want to name them and then dismiss them, if that's okay with you, and then talk about the ones we think are kind of viable now. So the first one, sort of a pet peeve of mine, is Ultherapy.
It's one that I've never brought onto my practice. I would not even have it done on my own face because of concerns about the discomfort, but also the potential injury, especially, lingering nerve malfunction, paralysis. That's not something I'm ready to sign up for me or any of my patients.
Yeah. So as a, recovering radiologist, I like to call myself, nothing would make me happier than to use ultrasound in aesthetics. It's, been my vocation for 12 years now, but it's just painful, but it penetrates. So the problem with ultrasound is that it penetrates and strong enough, it'll damage anything underneath it. So the big thing is, it can kill the thyroid if you do the neck, and you can do nerve damage, all kinds of things. All right. Yeah. Forget Ultherapy. For everybody listening, we don't like it. Okay. So then what about Thermage? We both sort of agreed, like also old technology.
It's old technology. So this is where I think the concept of monopolar RF is fantastic. And that's energy that, like, they were on the right track trying to harness that. But with the pulse delivery and then pulsed gas cooling, it had a couple of significant issues. One, it was very, very painful, again, for patients. These devices are all working by trying to impart heat deeper into the tissue, and they, in turn, can burn the epidermis. and so Thermage it was kind of like great idea, but poor execution that was painful with, again, some problematic side effects.
Totally agree on all that. And actually, when I started 12 years ago, Thermage was already kind of old back then.
Same.
So, okay. And the third one is a device that I have had a long time ago, Exilis, which started out as Exilis Elite, and then it was Exilis Ultra. And that actually used both RF and ultrasound, also in an attempt to heat from the outside in. Mm-hmm. And it had surface cooling. And the problem that I had with that is it was so operator dependent that it was really hard to get good results with that. Like, it wasn't a bad idea. It just was really difficult to implement and get good results across the board.
I was the operator of that device over a decade ago when it was brand new technology. So it was the first iteration of it. And it was operator exhausting as well, because you had to continue moving your hand in these
workout
circles. And at the time when I was using it, you had to use your other hand to hold the thermometer and see if you were actually getting to the right.
Yes. And then it was the thing where it was measuring that as you went, but still, it was really, really difficult to make that happen well.
It was. And as soon as you would get anywhere close to that magical 40 to 41, I never could get anyone to 42 degrees, because then they would jerk their face away and say, ouch, and you had to follow them. Otherwise, you could burn them. You could art the patient with that.
So I think the concept of trying to heat from the outside in is like, it's nice, but it takes more technology and more skill, or, a more standardized treatment to make that happen. So
I agree.
Now we have kind of like this wave. There's multiple devices now that are like next generation heating devices where it's essentially less pain or no pain. And we can talk
Mhm.
about that. And then better cooling, better results, no damage to tissues underneath. So I know that you have one of them. I have a very different technology one. So what most of these devices do is more like the one that you have. So let's talk a little bit about those, the one you picked and why you like it, and then some of the other ones because they're very interesting to me and they all claim to do different things. And the one that I don't like the hype, there's one called Zerf that everybody's hyping big time
Mhm.
that I have questions about.
As
So,
you should.
well, so you have the one called Everest. It's by
Yeah.
Cartessa, and
Mhm.
that's a company that's based in New York.
Mhm.
So it is based in the US. They are backed by private equity. I always look into these things because when I buy a device, I know I'm marrying the company. So
Mhm.
I kind of have to not hate the part of why I don't like Zerf is I kind of hate but no, whatever. They're
Mhm.
kind of not a positive actor in the universe. But so tell me how Everest works and then how that compares to these other ones we're going to mention. So the things that I found, I'm kind of curious to know what's on your list. The RF ones that are similar are Everest, Zerf, Neurotite, which I had never heard of until I was researching for this
Yeah.
interview. And then Jace's makes one called Density. That sounds
Mhm.
slightly better to me. So tell me about Everest and specifically why you like that one.
So Everest is, yes, it is distributed in the United States by Cartessa. So Cartessa is a laser distributor and a device distributor.
Okay.
They don't actually produce any of their devices, which gives them this world of literally the whole world of options. So
Mhm.
Cartessa goes to laser and device developers, companies all over the world, and studies and selects those devices and then brings them over and goes through the process of getting them FDA cleared, FDA approved in the US. And
Okay.
then they bring them over. So Cartessa works with multiple device producers, manufacturers all over the world. The Everest device is produced by Classis, and Classis is a South Korean company. It's one of the largest energy based device companies worldwide. They are backed by Bain Capital,
Mhm.
and they have a strong, long history of safe, effective devices in the industry. So,
Yeah, and for
um,
everyone, like, a lot of devices are produced in Korea. Obviously, they're kind of at the forefront of skin in general. I have several devices in my practice that are from a Korean company, and they're phenomenal. So there's
yeah.
absolutely no shade on Korea.
No shade on Korea at all. In fact, that was something that was intriguing and interesting to me about Everest because I
Mhm.
care about the origin story of the device. I don't want something that is fresh off the manufacturer platform that hasn't been used and studied with histology and safety and efficacy data over
Right.
a period of time. I've been an early adopter of things in the past, and I like being on the forefront, but I also like doing so with a good track record of safety and clinical data. And that's what
Mhm.
Classes, just as a company, has done a really beautiful job with Everest.
So Everest uses a monopolar RF that
Mhm.
is at what, 6.78 megahertz? Is it
6.87 megahertz. Yeah.
6.87? Okay. Well, go.
Yeah.
Didn't know I had dyslexia. So, and that's pretty shallow. So it's pretty much targeting the skin,
It's
right?
targeting the skin. It's targeting specifically the papillary and reticular dermis.
Right.
And that is really important when we're
Yes.
talking about radio frequency, as you know, because what's deep to skin? Fat.
Bad.
And what
Yeah.
do we not want to do?
Well, in the face, we definitely
In the
don't want to
face,
hit the fat.
we don't
And
want to
that's
hit the
really,
fat.
really important. So one of the biggest complaints, there's no reliable way to know if a med spa is following safety standards or cutting corners. Until now, the Med Spa Board certifies clinics that prove they're doing things right, verified products, licensed staff, and actual medical oversight. It's the difference between rolling the dice with your health and knowing exactly who's holding the needle. If you're looking for aesthetic treatments, go to medspaboard.com to find certified med spas near you. And if you already have a med spa you love and they're not certified, please send them our link. If you're a med spa owner doing things right, get certified and show your patients you're not cutting corners. As a bonus, certified spas also save a ton on malpractice insurance. Do the right thing and go to medspaboard.com. Keep listening, keep asking questions, and stay safe out there. About various different kinds of treatments over the years, especially when they're done by the wrong person and doesn't know what they're doing, is fat loss from where you're trying to tighten the skin and then the underlying fat is diminished and that makes you more saggy, not less. So I think that's very, very important. So we're targeting the dermis with heat and that stimulates the fibroblasts to make collagen, right?
Exactly. That's how it works.
And is there any histology that shows that it stimulates elastin as well? Have they
It
shown
is
that?
actually in the same clinical study that shows the increase in collagen production. There's also demonstration of the increase, and it's statistically significant, of elastin production, also of the overall thickness of the skin. The study that was published just a month, 4 to 6 weeks ago, it was actually presented at a conference I just attended, actually was a head-to-head study against Thermage, comparing the improvement of collagen, elastin, and skin thickness, as well as the pain level.
Yeah.
And it was very well done by a physician in South Korea.
So we're stimulating collagen and elastin, and it doesn't hurt, right? It's got really good cooling. You want to explain that?
So the cooling is really important. So the reason we have to cool the skin with radio frequency is otherwise the epidermis says, ouch, this is too hot, and the patient doesn't tolerate it. We also don't want to burn the epidermis.
Yeah, and if you don't keep the skin cool, people will just jump off the table and say, what the heck are you doing to me? So yes.
They will. It's so important. So yes, so the old way of cooling with RF delivery was called pulsed gas cooling, where it would basically deliver a pulse of heat and then chase it immediately with a pulse of cold gas. So it would get really hot and then it would get really cold. And you would end up with this uneven temperature gradient, trying to almost average out to where you wanted to be while desperately trying to keep the patient comfortable. And it truly didn't work very well. Ask anyone who's had Thermage. It hurt.
Yeah.
So what Everest does is through the tip that is in contact with the skin, there is continuous cold water that's running through the tip. So the epidermis maintains a cooling sensation while the heat gets delivered beneath it.
Does it actually feel cool or does it still feel warm?
It still feels warm.
Yeah.
Because it is still warm. Yeah. So you don't feel cold while heat is being delivered, but it feels warm. I would equate the majority of the treatment when I demoed it to a warm to hot stone massage on the face.
Okay.
And that really is, especially on the softer parts of your cheeks, it feels like a hot stone massage. When you do hit these classic areas where you have a very superficial sensory nerve running right over bone, that is the place where people will say, oh, I feel that. I feel that. And that is very normal. So I tell people it's not that it's painless, because pain is a very subjective sensation. And patients who hate their skin, if they hate heat, they may really not like those 2 spots on each side where it gets a little bit hot. But it's a very comfortable procedure with maybe 2 spots per side that get where you feel the heat. But by the time your brain processes it, it's moved on to the next area.
Mm-hmm. And it's a lot easier to implement. So tell me a little bit of that. It's stamping.
It's stamping.
So movement across the skin.
Right. It's not this constant circular motion. You just stamp. You do 50% overlap. So the pattern is incredibly easy to follow. And one technique that we use to minimize discomfort in those hot spots is what I call them, is we just do a little bit more of a glide. So instead of stamping and staying, we stamp and glide just a little bit. There's also
there is a little bit of a technique to it.
There's a technique, but the other nice thing about this tip, in addition to having the continuous water cooling, is that it's curved. And the tip gold plate extends out to the edges in a curved fashion because our face is curved. Our bodies are curved. We're not flat. And so it captures and moves with the curvature, so there's no gaps. And with that, you don't have the risk of arcing the patient when you have that energy being delivered partially, and then there's a little oxygen right there. That's what can generate that burn. And the tip, it won't actually even fire if there's not adequate contact with the skin.
Right. So for people who might not know, who are our audience members who are not clinicians, what arcing really refers to is with most of these devices, if you were to have it on and pull up and there's air in between the probe and your skin, there's this zap that does not feel good. And so there is this arcing problem with many of these devices, especially the older ones. And so that is hopefully never going to happen with the Everest.
Yeah, it won't fire.
It won't
So
fire.
that is it won't fire. They really covered
Yeah.
that, and that was important to me, having done Everest, and I never personally arced anyone because I was pretty quick in chasing them, so they couldn't get away. But that was an important consideration.
Yeah. Back when I did have Exilus Ultra, like 10 years ago, and I trained people to do it, it made me really like nervous. Like I'd be like, okay, now don't pull up. Like don't pull up. Like, I'd really, really have to make sure that they learn that technique. So how long is the treatment and how many treatments do you need and what kind of results do you see?
The treatments generally last anywhere from about 30 minutes, 30 to 45 minutes. And it just depends on, are you treating the lower face to address more of the nasolabial folds and like the marionette lines coming in the jowly area? Or are you doing a full face treatment, getting a little closer to the eye with the smaller eye tip to give a little eyelid lift and the neck? And if you're doing all of that, then you're probably delivering 1,000 pulses of energy, somewhere around there. And that could take you 45 minutes to an hour. So you're in that range. What's nice is that your patient does not have to numb at all. So they come in, they get prepped. We do apply a grounding pad to the back because it's monopolar RF. We need to ground them. This is not appropriate for patients who have a pacemaker or a defibrillator.
Where the RF goes through you basically. So you can't have anything where your heart might stop. Does metal get in the way? What if they have like rods in their spine?
If there's rods in their spine, we would try and avoid placement of the grounding pad where that energy would be traveling between it, but it is a consideration. Sometimes we just modify where we're treating if we need to. So that's a consideration with it. We are able to do it on patients who have dental work. That's not been an issue. We may not go right over the upper lip if they have a lot of upper, metal on their front teeth, but it has not been problematic. The defibrillators and pacemakers are a big deal. That's a total contraindication to doing this.
For my device too, I can talk about that in a minute, but we have M-Face and that also requires a grounding pad and same thing, right? You just
have to know you need to know your patient's history anyway, which is the importance of having great medical supervision when you have these devices.
And then, so it's usually 2 treatments or more?
So usually the protocols that have been studied, and I do like to stay with the data on this, are 2 treatments. And the spacing of the treatments is interesting. In Korea, they tend to space them out a little bit more, like 12 weeks apart. But I couldn't really decide. I couldn't figure out why that I would wait 12 weeks rather than 4 to 6 weeks as we do with Sculptra and other biostimulatory treatments. So we space them 4 to 6 weeks apart, and we do 2.
Sure. And what I always tell people is, you're stimulating your fibroblasts generally 4 to 6 months. Like within 4 to 6 months, they're back to being dormant if you did nothing more. So I always like to do the next treatment before they poop out, and just build on what you were stimulating before. So it's probably arbitrary, but most people in America don't have that much kind of patience to wait that long. Right?
It's true. It's true. And I think with this one, people are actually looking forward to their next treatment because they walk out. The Everest, it stimulates some nice, healthy blood flow to the face. And it gives you this immediate tissue contraction and tightening. It's a great thing to do if you have an event the next day because you will have this temporary, immediate.
That is temporary. Let's make sure.
It is temporary.
Yes. All of these devices, even the old not so great ones, did that, right? And back then, the reps would sell it like, see, it's working already. And it's like, oh my God, that's edema. Okay, I think that's not
Right.
any kind of
But I
permanent
talk
result.
about it like I talk about, the water that we use along with Sculptra injections. Like we know it's the PLLA particles that are going to lay down that we inject. But for 24 to 48 hours after you've had Sculptra, you might have 18 cc's of fluid in your face. And that's going to that might make you look great. But you have to say goodbye to that.
Yeah. Well, I always, the initial poofiness though might be a lot. Like with
it can be a lot.
There's a lot of poop going on with that. So I do think it's interesting though. So there are these other devices that use RF and they're newer and they're touting very similar things. Cooling is the number one thing, right? So they all have developed different ways to make it more tolerable. So I'm curious, did you look at neurotite or density when you were evaluating Everest?
They were not out.
They weren't around. Okay.
They were not out. I learned about Everest in the perfect moment for me when I was going into summer in my aesthetics practice in Georgia, and I knew everyone was going to go to the lake or the beach or be out in the sun, and I wanted a treatment that wouldn't interfere with lifestyle.
Yeah.
And Everest was presented, and I liked what I saw with the clinical data that was comparably robust to what else is out there in the space. Had I been looking at it now, it would have been an even easier decision because I would have looked at these other devices and said, where's the data?
Yeah. Well, I think that it's really interesting that Zerf is going crazy right now. So I'm kind of curious to know your thoughts on that because Zerf is a device that also uses RF that also claims to have better cooling. And they have two different frequencies of RF. And one is the same as Everest. That's the 6.87, right? But one is 2, and 2 megahertz will make it so that it goes much deeper. And 2 megahertz will be basically between 2.5 and 5 centimeters into the body. So, I mean, how is it that they are? So I've seen a lot of hype about how it penetrates deeper and therefore it's better for lifting. And I just cannot figure out how those people are saying that. It seems counterintuitive to me.
I am not a physicist. And so I cannot I'm also struggling to wrap my head around how something can claim to go deep to SMAS, so the deepest tissue layer over bone, through the fat without impacting it. However, I think there's got to be something with impedance or resistance or the ohms that, again, I am not a physicist, that I don't understand. This claim can't have come out of nowhere. But here's the problem. Nowhere is there any data that validates this claim. There's really one study that's been done on Zerf that's been published in the literature. It was published in 2024. They actually had to issue an edit because it initially said that it was not, that the authors did not have any financial disclosures, but the authors actually work for the company distributing Zerf. So they had to redact that and say it. But it was a study done just to prove out safety, and it was done on 2 to 3 month old pigs. Pigs.
Right.
That's the data, and that's it. There's no human clinical study that's been published on this technology. They showed that it was safe in 2 to 3 month old live pigs. That does not impress me because human skin and pig skin are quite different. And I know they're used in research as an analogous structure.
A lot of studies start in pigs. There are tons of really important pig studies that were the beginnings where you could show efficacy, then you would turn around and do human studies. So it's just very important to be able to know that these things work in humans. And then also, like, how many times have pigs complained about fat loss? Okay. So that would be like my number one concern about Zerf. I don't want the company to come after me now for talking about this on the podcast, but that would be my concern. Would be those deeper the deeper frequencies would potentially destroy fat. And I really would like to see studies in humans of that. And right now that company's busy selling the snot out of this thing all over the country. I just find that like it's just really interesting. I've heard a lot of people talking about it, and clearly, as a physics geek, I'm like, wait a minute, that doesn't make sense. I don't know either. Like I don't own that machine. I have no real battle with the company that is distributing it. So I don't know. I don't know enough about the neurotiter density. I think that
Yeah.
those companies, so I mean, neurotite is Luminous and density is Jasus, and they're both well-known companies in the aesthetic space. They make good devices. I don't know. There's one
I
there's one additional one I want to mention that I also kind of don't like, and that is SofWave. That is not RF, that's ultrasound.
Right.
Um, and as I mentioned, I love ultrasound for diagnostic
Mhm.
purposes. And from everything I understand, SofWave is also a little more painful than any of the
When
RF.
it was the first one that I considered bringing on, and I was kind of late to the SofWave party. SofWave just sat there as a company or as a device, not really doing much of anything until, I don't know if a Kardashian had it done, but that seems to be like the gateway into social media fame for a device. But somebody had it done, and then SofWave did this massive marketing ploy. I looked at SofWave, and my esthetician looked at me and said, "My last dermatologist owned it. People were crying. Like, it hurt so much." And we treated another esthetician, and she loved, just to put this in perspective, she loves Morpheus 8. It's her favorite treatment. And she's like, "Dr. Erickson, this is way too painful. We can't do this to patients." And that's what she said about SofWave. I was like, well, I don't need a lot of tears in dermatology. And I still had some significant reservations about ultrasound
Yeah. So
technology.
is it more painful than all therapy, or is it as painful? Because that's
No,
also
my understanding is it is not as painful as all therapy, but it still is significant. And it's really hard to numb out stabbing heat as a sensation. That requires almost sedating the patient to get them through that, which also is just not something that we do in our practice.
I do want to mention the device that I have because I really do think that it fits in well in this category, even though it's wacky and different from the other machines. Because I have M-Face, which
Mhm.
one of the many reasons I like that. So it does two things. So it does RF heat, and it has been shown in many studies to improve collagen and elastin. But then also it stimulates the lifting muscles selectively in the face. So it kind of, when you have it, it's really freaky, but your face kind of involuntarily does this
Oh,
and it
yeah.
lifts from it.
I had it done.
Um,
It's actually kind of a cool sensation.
it is, it's weird. And I will say that like it does do long-term collagen elastin, but it also does this lifting that's immediate. Like I really like it for before events, like you were saying, for
Mhm.
FRS events or weddings or photo shoots or something, because it really does lift tissue up into your cheeks. So your cheeks get a little better and everything gets a little lifted. And, at 58, I could use a little bit of that.
Yeah.
The drawback on Excellent, it is also RF and you need a grounding pad. So same
Mhm.
problems with that. But it is these applicator pads that go on your face.
Mhm.
And so the collagen and elastin that you get is only where those pads can go.
Right.
And so they've added more pads. There's one for submentum now. Anyway, there's one for under eye. But okay, so the big place around the mouth where that's our biggest concern, us, almost 60.
Absolutely.
Right. So all around the mouth, around the eyes and around the mouth, and as close as you can get to that, if you can do any treatments, one of the reasons I do love RF microneedling for me is you
Mhm.
can get right up close to all the
Yeah.
places you want to treat. And it's very effective for that. So, but with M-Face, you only get where the pad is, and
Yeah.
so you can't get the into all the skin, which is why I've never felt that M-Face was a replacement for any like RF microneedling or other treatment where you could do
Mhm.
all the skin. But it is super painless and it definitely works. So it's kind of it fits in this category, even though it's a completely different device
Yeah,
entirely.
no, it is really interesting, and it's a fun treatment to be able to offer people. I was looking for a device that could be a real multitasker when I brought on the Everest. And since it's a device where you can change the size of the tip, there's this very small tip that's about a quarter, maybe a centimeter squared. It's the very small eye tip that you can get right up under the
Really?
brow without going over the orbit. You can go right up under in the infraorbital area, and you can go across the upper lip to help address a little bit of those upper lip rhytids, and sometimes even get like a little bit of a lip flip. I think some people feel that that's a little oversold. I don't ever promise that to my patients. And then there's a
Uh-huh.
big body tip. And so you have the one device, but you have a larger body tip that you can use to treat the abdomen or the thighs or the arms. I just learned the term sleevage the other day. That was a new one for me, but
Sleevage?
we're going to be playing with it for sleevage treatment.
Okay. So for those of us who want to wear a tank top and there's that part
That little,
or
just
what?
that little pooch. Yeah. Just work on reducing the sleevage. And you can do that with
Reduce
your RF microneedling as well to
recovery
tackle it.
time on arms can be quite long with RF microneedling. So with that, face recovers very quickly. Neck takes longer. So face is like, a few days, neck is a couple weeks sometimes. And then I always find the lower you go in the body, the longer that takes. So
Yeah.
so that's kind of a problem if you want to do your arms and your arms look not kind of normal for a long time. So this potentially would be good for that. Obviously, M face
Yeah.
doesn't
We're
have
in
have
we're
that.
enjoying it for the body. I think the hardest part with the body, well, the hardest part with any of this is like you see that immediate contraction. You love
Mhm.
what you see, and then it kind of dissipates, and then you have to wait for it to come back. So it's with any of
Yeah.
these devices, it's so important to just counsel the patient, set expectations, make sure people understand that yes, there's this great short game and you're going to look great for like a day or two or maybe 3, and then that contraction relaxes, but then it's gonna take months for true collagen remodeling and longer
Yeah.
term benefits.
I think also realistically, when you go to lower down in the body, if you obtain like let's say a 10% tightening, let's just pretend. I'm going to throw
Yeah.
a
Okay.
number out because I don't have a number for that. But let's just say, so your face has kind of all these tuck points and whatever. 10% is very noticeable on your face.
Mhm.
Okay. But you get a 10% tightening on your belly, let's say post childbirth belly or arms after, it's going to be hard to tell. It's going to be not significant enough to be like, wow, that was great. So glad I did that. And I always warn patients, like, that's the expectation setting thing is like, if you
Absolutely.
if you're really upset about your sleevage, I like that term. Okay. This may or may not,
Yeah.
change your upset level about it. Cause it's so hard to create that a big enough diameter change or whatever, tightening in your
Well,
arms and belly.
and there's so many factors at play on the body. Like oftentimes where I practice, there's often more sun damage on the body skin than there is on the face
Mhm.
because people have at least been wearing sunscreen on the face. So you have this very thin, very fragile tissue that's very crepey and often dry. And then you have, you know, cellulite, which is in that area too. So I think the body
Yeah.
is just one of those areas where we've yet to have a device that really addresses all of those layers
Mhm. Yeah.
together really effectively without taking you out for, weeks.
Right. Well, for most people seeking those kinds of treatments, they really don't want to go to a plastic surgeon and have surgery.
Right. Right.
But our treatments are somewhat limited. I mean, we also have Emsculpt Neo, which does a pretty good job, especially abdomen.
Mm.
But do you do body sculpting as well? I mean, now with GLP-1s, very few people do as much body sculpting as they used to.
No, we never really had the demand. And one of my main criteria for bringing on a device is what are my patients asking for? And my
Mhm.
patients were all pointing at their jowls and
Right.
saying, "Can you get rid of this? And by the way, I'm going to keep playing pickleball." So I listened to my patients and they wanted their
Yeah.
jowls and they didn't want downtime.
Mhm. Yeah.
Everest has been a really good fit for that.
Well, so if somebody's looking for a painless skin tightening treatment, like what would be your number one piece of advice if they're out in wherever part of the country they are? What would you tell them to look for?
Well, I think that still operator who's doing the procedure still really matters. I would be very weary of these newer devices that of what I would consider more social media fame like Zerf, because unless you are a 2 to 3 month old pig, there's no data on what it's going to do for you. So I would just I would just X that one out for me personally immediately. I wouldn't buy it. I wouldn't do it. After that, I would find out what are the kind of credentialing and experience of the providers who are managing the device. And excellent, and like Everest is probably not going to be a physician in a lot of places because it is truly one that can be so safely delegated. And all of that depends on state rules, of course. So I would look for that. And then I would just also make sure that they're setting expectations appropriately. If someone tells you that it's going to give you facelift like results in 24 to 48 hours, you should run the other direction because that's not a reasonable expectation. They just want your money. You want to sit down with someone who's going to talk with you about how it's working, how it's heating the tissue, how it's cooling the skin so you're going to stay comfortable and not need to numb. That you'll see this immediate improvement and it may last 48 to 72 hours. And you'll enjoy that and schedule something fun to do the next day appropriately. But then it's going to take time to build collagen and elastin because that takes time.
Yeah.
And then how long does it last? It lasts as long as your new collagen and elastin last, right?
Right.
Like we're not in this constant state of gaining. We start losing it starting around age 18 to 20. So, but the good news is that there's other ways that you can support your skin to hang on to what you've invested in building.
So always use a really great skincare regimen to support the results. So, if you're trying to build collagen, then use serums that stimulate collagen. You'll increase your yield from any treatment like this. And I totally agree. I think that really important part of what you just said is talk to the person who's explaining this to you. Make sure that they make sense and then they're logical. And then ask them their license, find out what their license is, find out if they have one, and make sure they actually have the kind of ability, one, to practice medicine or to be under someone who can practice medicine. Because a lot of these people selling stuff to you, whether it's on social media or in these, med spas, really can't. They're just doing this illegally and they're selling a treatment that
Right.
does not have any FDA approval, doesn't have any data. So that's my thing is find out who's doing it and find somebody who really can do that legally and ethically and they're telling you the truth.
Yeah,
Yeah.
it's so important, and I think that's how we're going to protect the aesthetic space and protect patients and continue to have so many wonderful med spas with excellent providers who are qualified is that we have to value that, and we need to educate patients to value that and ask for that and seek it
Yeah.
out.
Well, and just a little plug for the Med Spa board, like ask if they're Med Spa board certified. And if they're not, ask them to get certified. That's what we're trying to do is educate the public about all this stuff, good and bad. You know, what technology works, what doesn't, what has science, what doesn't, what's FDA approved and what doesn't, who's allowed to practice medicine and who's not. I mean, it's
Right.
right now, it's just super hard for people to tell. I mean, obviously, if they go into your office, you're a board certified dermatologist, you're clearly allowed to do what you're doing. But my place, I mean, my name's on it. But my place doesn't look all that different for, the average person just looking than the illegal place down the street that has no doctor and no legally, licensed people. And it's hard. Like people just can't tell the difference. So that's what we're doing. We're trying to educate people.
It
And
is important, and it's so hard because what happens is the devices end up getting blamed. Like
right.
recently, the
Yes.
huge FDA warning on RF microneedling. That's
Right.
not the device's fault. It's
Absolutely not.
excellent technology. It's the hands that are operating the device and the probable lack of supervision. and
Yeah.
training and regulating on who can do this. These are powerful machines.
Well, even just knowing the physiology of the skin and knowing how deep the dermis is. Okay. So, we know where the dermis is and what's too deep, where the fat is, and we don't want to hurt the fat. And I can just tell you that's why the whole conversation about Zerf is bugging me because, we know we don't want to go deeper and we don't want to injure anything deeper. But all the people who have no medical training, they don't know physiology or physics. Yay, deeper, stronger, better. And I'm like, no. Like I have cases, that we've talked about on this podcast where, an esthetician was doing a non-FDA approved RF microneedling on someone, and she just turned it up and went deep, and she had third-degree scars and killed the fat, and this woman has permanent scarring from that. And the people who are not trained in medicine just do not know the anatomy or the physiology or physics in order to be using these devices properly, I mean, obviously that makes me very upset, right? Because people are walking around scarred for life from that, right? So, okay, people, do your homework.
Do your homework. Do your homework. Ask good questions. Like, educate yourself. There's lots of options out there for who can deliver these treatments. You get to choose who the best fit for you is, and you should be picky. It's your skin, it's your face, it's your body.
Absolutely. And the person should not be offended if you want to know what their license is. Because if they have one, they will not be offended. Oh, here it is. Right?
It should be framed and hanging up right in front of you. So hopefully you can see it. And if it's not, again, like you need to make sure you're in the right hands.
Dr. Erickson, I'm so happy that you were able to come on today. It's a really interesting topic because we've all been wanting to have these kinds of devices that can do this sort of painless, a little bit easier. I mean, obviously it's not going to be as gangbusters of result as something more invasive, but a lot of us don't want to have, the bigger procedures, right? And it's really great to have a non-invasive, painless thing, no downtime. So very exciting times we're in.
Yeah. And Everest has not disappointed. Everest has continued to impress me and my patients with appropriate expectation setting, which is so important when you're doing anything aesthetically. You need to let the patient know what the range of outcomes can be. Because also everybody's different and how their bodies are still functioning.
Thanks so much for being here, and hopefully we'll talk again sometime soon.
Thanks for having me.
Thanks for listening. If this episode opened your eyes to something you didn't know before, share it with someone who needs to hear it. Subscribe so you don't miss the next one, and drop a comment telling me your biggest takeaway. I actually read them all. Join me on this mission to keep you safe and push this industry to do better.